Hi everyone, this is Vignesh from VNMU. Today we are going to see about venous drainage of the heart. Already we saw about the coronary arteries which present in the heart. So today we'll see what are the veins which present in the heart. So these are the veins which present in the heart. So the coronary sinus, these all veins which drain into the area is called the coronary sinus, which present in the right atrium. It's exactly here. And then these are the veins, which is a greater cardiac vein, posterior cardiac vein, left cardiac vein, small coronary vein or cardiac vein, oblique vein or martial vein, and then anterior cardiac vein, and then thebesian vein. So now we'll see the veins where it exactly located. So the coronary sinus, which is exactly located in the right atrium. So the all veins which come from the heart, which is drained into the area, is called the coronary sinus. The greater cardiac vein, which arises in the apex of the heart, exactly arises here, and it goes anteriorly in the upward manner, goes like this, and then it turn and it make loop in the left auricle. So I'm making dotted line, so the posterior view. So it covering the posterior part of the heart, and then it drained into the coronary sinus in the posterior manner, the posterior aspects of coronary sinus. So the greater cardiac vein which arises in the apex of the heart, and it goes anteriorly upward manner, and it make a loop. So it goes in the posterior part of the heart, and then which is drained into the coronary sinuses, and then the posterior cardiac vein. So posteriorly. So it arises in the interventricular septum. So we can call it as a middle cardiac vein or posterior cardiac. It arises in the posterior manner. So I'm making it in the dotted line. It goes anteriorly in the upward manner, and then which drains into the coronary sinuses. So it arises in the posterior manner, and then which is drained into the coronary sinus, the left cardiac vein, which also arises in the posterior aspects of the heart, which arises in the left ventricle. So it goes anteriorly in the upward manner, and then which is drained into the coronary sinuses, and then small coronary vein or cardiac vein, which arises in the right ventricle. So it goes anteriorly in the upward manner, and then it make loop in the right atrium. So it covers the posterior part of the right atrium. So I'm making the dotted line, and then which is drained into the coronary sinus in the posterior aspect of the heart. So and then the oblique vein or martial vein, so which arises in the left atrium. It comes like obliquely, and then it drained into the coronary sinuses. Martial vein or oblique vein, which arises in the left atrium, it comes in the oblique manner, and then which is drained into the coronary sinuses. The anterior cardiac vein, which arises in the left ventricle, which directly drained into the coronary sinus, and then the sebaceous vein or cordis minimus, vena, vena cordis minimus, vena carda minimus or Tabacian vein. Assume this is a Tabacian vein. So the veins, the smallest veins which come from all over the heart. For example, the right auricle, right ventricle, left auricle, left ventricle. So the smallest veins which come from all over the heart, which is drained into the area, which is the coronary sinuses. So these are the smallest veins which come from follow the heart, so which is called the thebesian vein. So now we'll see the overall. The coronary sinus is exactly located in the right atrium, which is in the red color, which is coronary sinus. The greater cardiac vein, which arises in the apex of the heart, and it goes anteriorly upward manner, and then it make loop in the left auricle, and it goes in the posterior manner, which is drained into the coronary sinus. The posterior cardiac vein or a middle cardiac vein, which is arises in the interventricular septum, it goes anteriorly upward manner in the posterior aspect of the heart, and then which is directly drained into the coronary sinus. The left cardiac vein, which also arises in the posterior manner of the heart, which goes anteriorly upward manner, which is directly drained into the coronary sinuses. The smaller coronary vein or a smaller cardiac vein arises in the apex of the heart, which is a right ventricle, and it goes anteriorly upward manner, and then it make loop in the right auricle, and which is drained into the coronary sinus, which is a posterior aspect, and then anterior cardiac vein, which arises in the right ventricle and which is directly drained into the coronary sinuses. The thebesian vein or vena cava minimis, which are the smallest veins which arises from all over the heart, auricle and ventricle, which is drained into the coronary sinus. So these are the venous drainage of the heart. Okay. Thanks for watching. We'll continue to some other topics on some other videos.